What is happening at the White House as it pertains to mask wearing? Do they want to mandate masks again? What is the source of the crux of the debate?
Well, as my colleagues and I at the Associated Press reported yesterday, Mika, there have been discussions within the White House between White House aides and officials at the CDC, other public health officials, as to what should be done with masks. Now, it was categorized to me by West Wing aides that these were sort of routine discussions. They've been having them every so often in weeks, just in terms of overall policy, health policy in response to the pandemic. But they have taken on a heightened urgency the last couple of weeks as the Delta variant surges across the country. Now, no decision on masks were made. The White House has made clear. They have said that they are deferring to the CDC. They're not interfering. They're going to let the CDC issue the guidelines, and the White House will then support them and push those out. To this point, those guidelines have not changed. Unvaccinated people are to wear masks when they're indoors. Vaccinated people, there's no recommendation that they do so yet. There have been discussions, though, and certainly there will be further talks in the weeks ahead as to whether that could change. White House Press Secretary Jen Psaki, notably, was asked about this yesterday, and though she said nothing was on the horizon, she did not rule out the possibility that there could be a change down the road, even as she was downplaying the nature of these discussions, saying, look, of course, you would want public health officials to consider all options. She said it's not imminent, but this is obviously something that they're watching very carefully here, and it would be, beyond the public health crisis, a real complicated political moment for this president, who just a few weeks ago was declaring our independence from the virus, who still has his administration pushing these vaccines to those hesitant or refusing to get it. And of course, if masks come back and more lockdowns come back, that would damage the economy, too. This is something this White House is watching very carefully right now, Mika. They know we're at a crucial inflection point.
And there's been a lot of talk this week about the masking of children, including from the American Academy of Pediatrics, saying kids in schools should be masked. And here's part of the reason why. The United States has seen a string of COVID-19 outbreaks tied to summer camps in recent weeks. One outbreak has struck in upstate New York, where more than 30 campers at Camp Pontiac, a 7-week sleepaway camp for children aged 7 to 16, have tested positive for the virus. That was as of yesterday. Nurses began testing last weekend after campers were showing symptoms of COVID-19. According to the public health director for the county, the camp, 31 of the camp's 550 campers tested positive. None, thank goodness, were seriously ill. All the infected are under the age of 12, making them too young to receive vaccines. So, Dr. Patel, this gets at an important question. No one who had the vaccine, none of the kids 12 and older, contracted COVID-19 in this case at this camp. All of the cases were among those who were unvaccinated because there's no vaccine, which raises the question about schools this fall, how safe they can be, and what mitigation efforts will be necessary inside those buildings until the vaccine for younger kids becomes available.
Yeah, look, I am such a strong proponent of schools in person, but exactly as you say, we'll need the mitigation measures. The Secretary of Education has been publicly traveling around the country to make sure that reinvestments are made into air quality, ventilation. That matters. I do support the American Academy of Pediatrics and their policy of universal masking inside of schools, 12 and under, as well as the staff and faculty, because of what you just said. Willie, the problem is not that we're trying to create fear amongst parents. We actually want to create a safe environment for parents so that you feel confident when I let my child go to school that they're going to be safe. The third leg of that is going to be surveillance and testing. There's been controversy over how much, what testing to do. The United States has been trying to stand up these regional testing hubs to support schools. We need to do that as soon as possible all over the country. And the one thing about that camp data that's really frightening to many of us is the secondary attack rate, that the 31 children are more likely than a year ago to spread this to other people in their households, a phenomenon we did not see earlier. And if you're unvaccinated in that household or older or immunocompromised, you are at risk.
So, Dr. Patel, before you go, I just want to make sure I understand this clearly, because there's going to be obviously a lot of people who are like incredibly against wearing masks and the kids wearing masks and closing of schools. But, we came into this show with Governor Kay Ivey, just remarkably saying it like it is, that, she can't teach people common sense. You need to get back. She doesn't even know what else to do to get the people of her state to get smart and listen to the facts and get vaccinated so people don't die. It's like that simple. And yet, now we're going to be talking about masks again and whether or not to open schools. Is it not the people who choose to remain unvaccinated right now who are causing all of this?
Yeah, there's no doubt. The data supports that, and the governor's frustration is just echoing everyone else who is seeing unnecessary hospitalizations, unnecessary death, unnecessary infections. We haven't even talked about long COVID or what could be happening to people years, months from now. We already know that that's something to be concerned about. So yes, it is selfish at this point to not get vaccinated. And let me say this, that if you are one of those people, get it out in the open, talk about your concerns. There are many of us who want to be able to kind of not just give you the facts, Mika, but be able to tell you why you need to get this vaccine, not just for yourself, but to protect anybody you love. And that's the way to think about it.
Right.
Who do you love that you worry about dying? That's your responsibility in getting vaccinated.
And just really quickly, Dr. Patel, pregnant women, I'm hearing so many different points of view on this. Should they get vaccinated?
Yes, absolutely. The American College of
any point in the
Gynecology.
pregnancy?
Yes, they should.
At any point in the
They should.
pregnancy?
Yes, they should. It should be, however, earlier if they can get their series so that they can develop antibodies, and absolutely take it up with your obstetrician. But we now know that this is safe for pregnant women and that we can actually give antibodies to the fetus, which can also be very protective for the baby. And that's critical.
Dr. Kavita Patel, thank you very much for being on this morning. Willie?